NP here, and if you are new, welcome, welcome, welcome. And if you are returning, hey, thank you so much for subscribing to my channel. I'm really appreciating all of the love I'm getting. And you guys, this channel is very fresh, so it makes me very happy to know that people are actually watching and taking information and enjoying the content, because my goal is to help you guys. So again, thank you guys so much. So we're gonna hop into this video. So for this video, we're gonna discuss documenting and charting as a new grad nurse practitioner versus when you're a nurse, because it's very different and there's a lot of different components. You are now a provider and there are different things that you have to address to fully document on patients, and I want to make sure that you guys have all the information that you need. I try to make my channel as informative as I can because, like I said, I've only been a nurse practitioner for a year, so as I'm giving you the information, I'm actually learning and going through it at the same time. So we're just gonna hop into this video. And I'm seeing that I have a lot of new subscribers, so I just want to take this time to say welcome. I appreciate you guys. I hope that you are finding the content to be helpful, and I'm just so very appreciative that you decided to subscribe to my channel. So thank you so much. So there are different components to charting when you are charting as a new grad nurse practitioner. So I kind of want to give you guys just a guide to follow. As you get more experience with charting, you'll be able to tweak it as necessary, of course following any guidelines that your company may have in relation to charting. But like I said, I just want to give you a blueprint to follow, since it is very different from charting as a nurse. So the components that I actually try to use in my HPI are the severity, the duration, of course, how long it lasts, when did it start, which is very important, and anything that is going to make whatever the complaint is worse, or kind of what helps alleviate it. So in that case, in the HPI, just for an example, as the sore throat, you would ask, how long did you have the sore throat? When did it begin? Is there anything that you've taken over the counter that has helped the sore throat, or is there anything that makes the sore throat worse? So those are questions that you want to make sure you're incorporating into your HPI to make it more thorough. So just sticking with the example of a sore throat, I'm going to speak out the HPI that I would write for this patient. So I would say a 30-year-old female presents with complaints of a sore throat times 2 weeks, period. The patient states that she has tried over-the-counter chloroseptic spray with no relief. Patient states that acidic drinks worsen her sore throat, and warm tea or warm liquids help to alleviate the sore throat. So that's kind of how your HPI should be. Now, a lot of people, like I said, are a bit more thorough, but I'm just giving you guys a guide, like I said before, to kind of follow. Then you move into your review of systems, and the review of systems is going to be the subjective symptoms that the patient experiences. Now, your review of system follows each body system. So, you know, you have your neuro, you have GI, you have GU, you have respiratory, cardiac. But in this case, if I had a patient coming in with an acute complaint of a sore throat, I'm not going to go into GU review of systems. I'm not going to ask anything about GU. I'm not going to ask anything about musculoskeletal. I'm not going to ask anything about integumentary. It just doesn't make sense as to why you would assess those body systems when the complaint is a sore throat. So for sore throat, you would stick with the HEENT body systems: head, eyes, ears, nose, and throat. But for myself, I actually will still ask respiratory questions, because some people may have a sore throat with shortness of breath, or I always ask cardiac questions just because I just feel like those are major body systems. In relation to the sore throat, you're going to ask in the review of systems, are you having any ear pain? Because a lot of patients with the sore throat may also have ear pain, and they may also have an ear infection, because we all know the sinuses and the throat and the ears are all connected. So you want to ask things about the ears. You want to ask if there's any nasal drainage or nasal congestion along with the sore throat. Then you move to your physical exam. So the physical exam is what you actually assess, not what the patient is saying is occurring. So that's going to be when you're actually looking at the back of their throat. Do you see any enlarged tonsils? Do you see any exudates? Is the throat appearing red? Does the patient have palpable cervical lymph nodes? When you look in the ears, is the tympanic membrane bulging? Is there fluid around the tympanic membrane? Is the ear canal red? Anytime you're dealing with any type of infection, that EMRA Antibiotic Guide is a quick and easy app that you can use. You know, you can also still use UpToDate, which you guys know from my last video. I prefer UpToDate over any other app, but to have quick access, like if you're out, you don't have your laptop, the EMRA app is really quick and easy to use. So I'm just gonna pull it up on my phone and I'll show you guys what it looks like here. And it has each of the body systems. So I'm gonna go to ear, nose, and throat. And it brings up all of the common diagnosis for ears, nose, and throat. I'm gonna go to pharyngitis, and it says on the app, it tells you exactly what the treatment is for pharyngitis. So for an adult, the treatment duration is gonna be 10 days, and the antibiotic that are recommended are penicillin, amoxicillin, cephalexin, azithromycin. And then it also gives you alternatives if the patient has a penicillin allergy. And you guys know from my last video, I said anytime you're prescribing an antibiotic, you always want to make sure, even if the patient doesn't have any allergies, you still always ask if they're allergic to any antibiotics. And then you want to make sure you go over the symptoms with them so that they know that what they need to notify you for. We're going to treat this patient with amoxicillin 500 milligrams oral twice a day for 10 days. Quick and easy, just using that app, how I figured out the treatment. And that is what you put in your assessment and your plan. And then what a lot of people forget when they're documenting in the assessment and plan is the follow-up. So you always want to put when you want your patient to return back, or any instructions that you want to give them in regard to any symptoms, or like I said with antibiotics, if you experience a rash or some shortness of breath, any type of allergic reaction symptoms, those are things you want to instruct the patient to either call your office for, seek emergency services, or just notify you so that you can change the antibiotic. But all of that can also be a part of your assessment and plan. So guys, that is it for this video. Thank you so much for watching. And as always, don't forget to like, comment below, and subscribe to my channel. And make sure if you are subscribed that you hit the notification bell so that you are notified every time I post a new video. I'll see you guys in the next one.